Record. All right. Okay. Well, welcome everyone to the final installment of our free women's virtual health series. Sorry, the golden years. That was a lot of words. And sorry, I just activated Siri on my phone. Um, and we are here with Dr. Krystle Wall from Advanced Medical of of the Twin Cities. Um, we are recording this event, so if most of you will be seeing this in the recording, and I'll send that out tomorrow. And then if you have any questions, please feel free to put them in the chat. So thank you, everyone, and Dr. Krystle.
Perfect. Thank you so much, Phyllis. I'm so excited to be here. I'm going to go ahead and do a screen share here. All right. And then go to the present mode and we should be good. Okay, perfect. Well, like she said, welcome everyone to the third part of our three-part series. So we're on to the golden years. And I know many of my patients anyways have been eagerly waiting this portion. So we will get into this. This is my father on the right, myself and Dr. Billy. We're from Advanced Medical Twin Cities, and we are in Golden Valley, Minnesota. We have chiropractic, massage therapy, acupuncture, nutrition, rehab. We do digital x-ray, mechanical traction, all sorts of stuff in one. And then I myself, I'm a chiropractor, I'm a dietitian, a lactation consultant, and an acupuncturist. So that's kind of my wheelhouse. I primarily personally like to focus in on women and children. Um, and I also have a background. I've worked in care centers in nursing homes and everything with my dietetic side. So I have worked with for a long time, have worked with people in their golden years. And then I continue with a lot of our patients who are fabulous, and most are not at that, most are thriving. Age is just a number. So, and that's kind of what we're going to be looking at here is how to help us continue to thrive as we get to those golden years. And again, as I throw this into everyone, those are my lovely children, Charlie, Anila, and Sophia. But this is also my opportunity to give you a little bit of a disclaimer, just that everyone is different. During this presentation, remember that this is educational, but everyone is different, and just please give us any questions that you have or talk with your healthcare provider. If anything doesn't feel good in your body, I do give a couple little exercise things. And just make sure that you are listening to yourself and your intuition and making sure that everything that you do is the correct thing for your body. All right, so our goals for today. Females face unique challenges and obstacles that can be difficult to overcome on our own. So we want to make sure that we are giving you guys tools to thrive, like I said. So first of all, we're going to talk about how the golden years body structure can actually modify the function. Then we're going to get into how movement can influence both peri and postmenopause. And then what we can do to help our body. So it's just some tips that you can take and go into play right away for you as you leave our presentation today. Okay. All right. So what are the things that the most common stressors on the golden years? So in this age category, what are the things that kind of cause the problems in our body? Poor posture is a big one, right? So that's pretty much every stage of life. And the more and more we're on our devices and not necessarily paying attention to sitting upright, doing things correctly that way, poor posture is a big one for everyone, every age. Then we also have peri and postmenopause. So we can have actual hormonal changes and changes inside our body that can be a big stressor. We also have work and work activities. This could be money or lack thereof money, injuries that we could have, car accidents, work injuries, maybe slips and falls, we're more prone to injuries, and we'll talk a little bit about that as we get into the golden years for multiple reasons, but one of them actually is related to one of our main topics here. Sleep positions can affect can stress our body. If we're 1/3 of our day is spent in bed or more, that's a big one. I have actually a whole talk on sleep while you age, how sleep changes while you age. And so that, if you're interested more in that, you can let me know too. Lack of activity, that certainly can increase our stressors. Typically, for most people, as you age, you're decreasing that activity level, which we want to a lot of times need to change our activity level, but we don't want to decrease it. Chemical and emotional stressors, that can be, by chemical here, what I'm meaning is what we put inside our body, could be environmental factors, and then also like the nutrition, what we eat, that sort of thing. I'm not meaning actual chemical things, but it can also be the medicines or medications and that you're more likely to be on as you age as well. And then we have all sorts of other factors that come into play. So what causes our body structure changes? And this is something that I really want people to understand, is that our hormonal changes actually do lead to a decrease in lean muscle mass and increase in fatty tissue. So as we get closer to the perimenopause, postmenopause, as we're going through that, our physiological structure starts to change. We can prevent that if we're taking good care of our bodies. It doesn't mean that it's a given. It means that we might have to work a little harder once we get to these ages to maintain the body that we're trying to maintain than we did when we were 35 years old. The next thing is the decrease in our estrogen causes weakness in the muscles and in the joints, which changes our posture. So if we're not as strong holding ourselves up, then it's more likely for us to slunch and fall into these poor postures. I use the example a lot of times where you see the little old lady that's like this, where her head almost looks like it's falling off her shoulders going forward. And there are a lot of factors that come into play, right? That can cause that. But one of them is, as we get to that peri and postmenopause time frame, or in menopause time frame, is that drop in hormones and not then catching that before it really affects our body to a state where a lot of people just give up. And we don't want to give up. We want to keep fighting. We want to keep getting our body as good as possible. If we're already in that stage where the head is kind of falling forward, and we're having really poor posture that we can't really straighten, that's something that, like a chiropractor like myself that specializes with the older population or aging population, can certainly help with as well. But posture instability, and this is one big part too, is posture instability actually can lead to increased fall risk. So I do want you guys to be aware of that part of this is not just about we want to have good posture. It's also that if you have good posture, your balance is better and it decreases your risk of falling. It's fun. And hi, Patty.
Hi,
Welcome.
thank you.
All right. We're going to move on to the next. And just so you know, everything is
Oh no, I think we lost her again. Can you all hear me? Or maybe you lost me. You lost me. Oh,
I can see you moving and everything now, Phyllis. Are you
I'm
good?
back.
I can hear you.
Okay, good.
Thanks. Sorry.
Perfect. All right, we're back on. I love technical issues. All right, well, we're back on. This one I have had on pretty much all of these because it is such an important key thing that I want you guys to understand. Cortisol is our stress hormone. So when you think of being very stressed,
I'm
this
listening
hormone
to
comes hand in hand with it. Now, if we improve our posture, there was a study, it's the Cuddy study. But if we improve our posture, for only 2 minutes of time, we can actually improve our cortisol levels and
This is a
decrease
tech meeting.
Okay, so our cortisol levels with that stress hormone and everything, we want to improve our posture in just 2 minutes time. We're going to improve our cortisol level and decrease our stress.
Wow.
So that is a big key factor there for that. Next, there we go. We're into movement. So movement is a big piece of the puzzle when it comes to peri and postmenopause, and it does change a lot. And I should define too, perimenopause for anyone that isn't understanding is just the beginning of menopause. So it can sometimes last for even years, so even a couple of years. So just making sure that you understand that menopause isn't like one day and it's done. We typically have our perimenopause time frame, and then that works into menopause and postmenopause time frames. So as our estrogen starts to drop, that's when we get into perimenopause. And I'm going to talk about each one of these things and how movement, so these are each symptoms of peri and postmenopause that we can do something about. So for instance, muscle loss is a big symptom that people can have in this time in our lives. And so isometric, which means your body's own weight, using your body's own weight to do the exercises, those sorts of things, and weight bearing activity, both of those can help with decreasing the chances and the rate of muscle loss that we can have. As we get older, our rate of muscle loss just in general it's very fast. So being in bed sick for a week when you're 65 versus being in bed sick for a week when you're 25, you feel real different. You actually get some muscle wasting and atrophy happening already. So we want to kind of watch that and try and help that as much as possible. And the next thing is night sweats. Doing aerobic activities like swimming and running, or low intensity activities as well, like yoga, are really great to help if you're experiencing a lot of night sweats. Hot flashes, resistance training can help a lot with hot flashes. So like bands, arm bands, that sort of thing can really help. Weight gain, just getting in that regular movement, regular exercise. It can look different for everyone, but just making sure that you continue to move is really important there. And then osteoporosis. So as the bones start to decrease, we want resistive exercises. So again, kind of that weight bearing activity, bands, those sorts of things will help with that. Now you don't want to, just want to be very clear, you don't want to jump right into one of these routines. You want to gradually, slowly move into it. And you could certainly work with a health professional like myself or Phyllis or your own health professionals on the appropriate level of increase for you and your body. All right, nerves, muscles, and spine. Oh my! So this is my wheelhouse, right? So how can chiropractic, massage, acupuncture, and other body work help? Oh, I did not switch that. Does not say cycle and fertility. This should say peri and postmenopause. So the main thing is we want to keep your joints mobile. So the more rigid we let our joints get, the more during this time. So like I said, remember as those estrogen levels drop, we lose strength, mobility, stability of the muscles and the joints. So they actually get weaker. We want to support those as much as possible. And a lot of these sorts of body work really helps with supporting those. It can also help with a lot of the symptoms. Acupuncture especially can help with a lot of the peri and postmenopause symptoms people have. But also, if your nervous system is working well, hopefully you're not experiencing as many of those symptoms too. Okay. Now, what to do? Oh, I'm pausing this guy. There we go. All right. First of all, check your posture. So see how you're sitting. Have someone take a picture or someone to analyze you too. How are you sitting and holding your body, sleeping, at work, at home, playing with the grandkids, whatever you're doing? How is your body holding? Then we're going to work on our core and connecting the different sides of our brain. And that's where I'm going to just really quick play this video. Again, this is one of those things that I'm highlighting each time because it's so good for every stage of our lives. But it's called the Neuro Boogie. And it's a great way to connect both sides of your brain and keep your body working. So we'll play this guy for you. All right, perfect. And then we just want to encourage movement. So especially as we age, there are so many opportunities for all of you guys in the golden years to get involved with lots of different things. There's Tai Chi classes, there's water aerobics, there's just go walking with your friends or neighbors or any by yourself, whatever you like, but really get moving. That's one of the best things we can do during this time. And then we can do some band exercises. And there's a YouTube link here. I know it's long. If anyone wants it separate, obviously, if you're watching this on record, you can pause it. I can also get it to you later. But this is a woman that I really like her band. It's a 30-minute band exercise workout that she does with her mom. And they show you in two different postures, so either standing or sitting, how to do things. It's really gentle and nice, gradual in movement into really using those resistance bands if you haven't before. So that's a great opportunity there. And then obviously to get yourself checked out by a professional, chat with Phyllis or I. And this is my contact information, and I would love to offer you guys a free checkup and care plan, so we can talk either in person or virtually to figure out what do you need, what does your body need, and really help you take that first step into better health during these golden years for you. So thank you so much. If anyone has any question that's on here right now, let me know. Did you guys not get volume on the video?
No, no.
Oh, have you not any time?
No, I just thought that was, I'm sorry, I didn't even think of asking about it because I thought
I did.
it was just a
No,
part
that's
of
okay.
the,
I am so sorry. I should have like bumped up the volume or something. Pretty much as you go through, I just sing. You miss my beautiful singing voice of row, row, row your boat with you. So doing it all together. So if anyone would like that sent to them separately, just the video too, I'm happy to send that to you as well. My contact information is on there, and then you can get kind of the whole spiel that goes along with it.
wonderful. Thank you. And I'm sorry that I didn't say anything before. I just thought, well, it
Oh
doesn't
no.
matter. It's a video. Like you're meant to watch
Yes.
it. I get it. Like it's just fine.
Sorry.
Oh no, that's okay. Um,
Okay. And I will stop sharing mine. And then Patty or Wendy, did either of you guys have any other questions at this point?
At this moment, I'm good.
Okay,
hmm.
perfect.
My
All right.
screen is not sharing.
I see you.
Okay, I can get that to you, Patty.
But you don't see my presentation though, do you?
No, I see just you.
Do
I'm
I
sorry,
see
I
you?
have a new computer and I knew it would not be a good idea to use it, but everything I did earlier worked just fine. Um, is it a Google Drive?
I stopped sharing, right?
Yeah, I only see
Okay.
the
Okay.
hat. Yeah.
Oh shoot. Sutalor, what is going on? Why? It says that it can share, but I have to maybe stop recording for a second.
Okay.
Let me see. Now something else is going on here.
Why don't you do row, row, row your boat while she's connecting?
Sorry, why? Okay, do you see it now?
No.
It says it's sharing. Oh my word. I'm so sorry. I might just have to do it without it. I don't know what else to do. Um, oh, here it is.
There we go.
Okay. So, but
Yay.
now what we want, oh, thank you so much for your patience. I greatly
No
appreciate that.
problem.
Well, once again, my name is Phyllis Jaworski. I'm with Sacred Ibis Botanicals in Hudson, Wisconsin. I'm a master herbalist, and my specialty is women's hormonal health. And so the majority of my practice is helping women with painful periods from endometriosis or fibroids to be pain-free, energized, and to feel like themselves again. But I have worked the whole gamut from girls to teens up into the golden years, but the majority of my practice has been the perimenopausal phase. So what is menopause? So as Dr. Krystle has already talked, that menopause is is a normal transition. Sorry, I have to like move you guys. Is a normal transition. It's a normal part of aging. It's a rite of passage for women. The process usually starts between the ages of 45 to 55. So this is perimenopause. And I've even seen with some of my clients into the late 30s, as early as the late 30s, just kind of depending upon what they have going on in their life. Menopause, the official start of menopause is when it's been 12 months since a woman's last period. So that's just then menopause. Typical symptoms within that time frame can be loss of bladder control, loss of sleep or sleep issues, hot flashes, weight gain, vaginal pain during sex, depression and mood changes, aches and pains, or some sort of inflammation, headaches, heart palpitations, and as many of the women I've talked to, there is just a whole lot of other things that could be on that list as well. Causes of symptoms of menopause. So, as Dr. Krystle had already mentioned, the key driver here, right, is the drop in estrogen and progesterone, right? So your body is going through this transition from, um, being in the stage of making babies, growing babies, and then now into those post baby years. Some other causes of symptoms are gut health issues. So poor absorption, whether this is from the use of hormonal contraception in your younger years, antibiotic use during your life, food poisoning, and also just part of the aging process is the intestines and stuff start to lose some of their integrity and some of their toning. And so there's just less absorption in general. Deficiencies, nutritional deficiencies, these can be caused by a poor gut health, by diet issues, by disease and illness. Again, and just like Dr. Krystle said, lack of movement, right? So we have to make sure that we're moving our body to keep up that muscle mass. And of course, movement also helps stimulate lots of other things, right? Like it helps support good mental health, it helps support the immune system as well. And then for me, part of my training is trauma and thought patterns and how they are stored in the body, and how that eventually those blockages will manifest into disease and illness later in life. Common nutritional deficiencies for women. So remember that these are going to be RDA, that is the minimum amount to meet nutrition in the United States. That is just, you may need more, is what I'm trying to say. So there are 3 regional nutrients that we are deficient in because of where we are. Vitamin D, because we're at the 45th parallel, there are 6 months of the year where we cannot make vitamin D, and so you need to be supplementing. I recommend 4,000 IUs daily all year long, just because that's enough to keep your vitamin D levels up high enough. It helps prevent SAD, it helps prevent mild anxiety, or it can at least help support that and keeping you strong in all the different ways. Vitamin D is as important for us internally as it is externally. And then next is iodine. So iodine is a C element and mineral. And obviously we are landlocked here. We are nowhere near the sea. So it's important to be getting this. And in fact, that's why people used to get the goiter pill. And so to replace the goiter pill, it was putting iodine in table salt, but most people don't eat table salt anymore. And processed foods actually don't contain iodine or iodinized salt. So you need to be getting iodine. So whether that's with a multivitamin. I recommend for all my clients a high quality multivitamin. But otherwise, you can do kelp flakes or seaweed flakes that you can add to your food. That's one of my favorite ways to get iodine. And selenium. So selenium is another C nutrient that most of us are deficient in, and it is very supportive. It works with iodine and actually vitamin D in thyroid health. And just eating 2 Brazil nuts a day is a great way to get your selenium. In the golden years, calcium is actually a nutrient that you need to bump up. And so 1,200 milligrams of that is the recommended daily allowance for women. B12 is important for a lot of different functions in the body, but it's actually really, really good for energy. Just like for my clients who are struggling with energy, B12 is something that I often recommend right away. And you need the 2.4 micrograms. And protein. So in the perimenopause presentation that we did last week, I talked about it was 0.8 grams per kilogram of body weight. But in the golden years, that can go up to 1.5 grams per kilogram of body weight. So me at roughly 130 pounds, my recommended would be 45 grams of protein a day. But that can go up to 68 to 102 grams for our golden years women. So protein is very key in those years. Zinc and then iron. So important note about iron is if you've been taking a lot of iron, so like even if you're going through perimenopause and you're still menstruating, once you hit that menopause phase where you're not menstruating anymore, you need to reduce your iron so you're not getting iron poisoning. So in the perimenopause phase, it's recommended to have 18 milligrams of iron daily, but post-menopause it drops down to 8. So that's a significant reduction in iron needed. Herbs to support the golden years. So if we're talking kind of about those perimenopause years or those years or the time frame, right, where maybe you get a menstrual cycle and then it stops for a few months and then it comes back, and just trying to regulate your hormones a little bit, chamomile is a great asset. Chase tree berry could potentially be helpful depending upon who you are and where you are in that process. And lady's mantle is a wonderful woman's tonic. I would also recommend, I forgot to put on here, is red raspberry leaf. That's just great for women in any stage of life. And that's definitely one that all women can have. It just is super supportive in helping with blood flow and the toning of the uterus in general. Inflammation. So many people have issues with soreness, and actually arthritis is like the big thing, I guess. Turmeric is a great support for inflammation. Goldenrod. I put St. John's wort in here, and not necessarily for inflammation like arthritis, but in that it helps with sharp shooting pains. So like neuropathy from diabetes, St. John's wort can just be a helpful ally with different kinds of sharp shooting pain. And then evening primrose is great for inflammation and helps a lot. And evening primrose can be used for all kinds of different issues in menopause. Loss of sleep and sleep issues. So valerian is another great plant ally here. One thing about valerian is that it does take time to work. It takes 2 to 3 months to be completely effective. And then also you have to watch contraindications with medications for valerian. Passion flower, a wonderful tasting, a great way. It's in a lot of nighttime teas, but a great tea for loss of sleep. And then oat straw. Oat straw is one of my favorite plants because there are no contraindications known. It's a great one to take daily. You can use large amounts of it. It doesn't have like a time frame, like it doesn't have like use it for 2 weeks. Like with passion flower, valerian, you do need to take some breaks and using it too, but oat straw you can take every day. There are no contraindications for most. I shouldn't say that because there could be for somebody, but I haven't run into any issues with it. Hot flashes and night sweats. So sage is our good friend here and helping with those. And red clover, again, it has phytoestrogens. It helps modulate estrogens. So for those in that peri kind of menopause, almost into that menopause phase, red clover could be super supportive there. Heart palpitations, motherwort. So we want to make sure that our heart is working as it should, being that but I don't know. I find that most people in the golden years are doing very important work, and we want to make sure your heart is working as it should. And the mild to moderate anxiety. Linden is a great, very gentle support here. It's used for children with ADHD. Going a little bit stronger, we have lemon balm. Again, chamomile is also great for anxiety. It's a very gentle nervine, bringing down anxiety and stress a little bit. Lavender, oat straw, and then for more moderate anxiety, St. John's wort, again, would be a great support. More supportive herbs, so for hair loss, right, because that's something that we run into as we get older, stinging nettle is a wonderful support for hair loss. Horsetail, because of its high silica content, so usually hair loss is a sign of nutrient deficiency of silica, so any of those, nettles is high in silica and horsetail as well. You do have to caution horsetail, so make sure you're working with a qualified practitioner with horsetail, especially if you're on different medications, but it can be super helpful. Vaginal dryness, wild yam, kudzu, and red clover are herbs recommended for that. In my practice, one of my favorite herbs or way to work with plants is with flower essences. Flower essences are a subtle, energetic plant medicine where it takes the vibrational imprint of a plant into water, and you can take that. This helps to release negative emotional imbalances that are stored deep within us. And I like to pair that with affirmations, right? So for releasing negative imbalances that we've probably had since we were infants and children, these things that we tell ourselves that we don't even really know we're telling ourselves anymore, and then replace it with positive things that we're, with that we want to carry with us now, right? So to help make sure those blockages don't come back and so that we can have lasting health. And digestive support. So when our liver is taxed and the liver can't support releasing toxins, those toxins then get reabsorbed into the body and come out through our skin. So dandelion root, burdock root, yellow dock, chamomile are great supports for the body. Most of them are bitters and those bitter receptors are on our tongue, so you need to taste these. And that helps stimulate the release of bile and other digestive enzymes so that you can digest your food better so that your liver isn't as taxed. I love to use plantain oil topically on skin eruptions. Plantain is a weed. Most of us find it in sidewalk cracks and driveways and in your yard, but it is actually a great support for skin health. Another great thing to help with digestive support are bitter blends and digestive enzymes. So bitters are, again, these bitter herbs that are in a tincture or some sort of form that you would take before or after a meal, again, stimulating the pancreas to release enzymes for the gallbladder and stuff to help digestion, and then digestive enzymes. So the most common one is bromelain, which is found from papaya, but that you can just take that when you're eating and that helps you digest your food better. Adaptogens. Adaptogens are herbs that are taken long-term. They help you adapt to a stress. So what's great is these are meant to take long-term. Most of them have very few contraindications, and they just help overall, modulate usually your process, your response to whatever stressor it is. So in this case, in the menopausal years, ashwagandha is a great support. It's usually used for hormone stuff, but it is also, it just kind of helps modulate that. And I guess that's what's super important between perimenopause and the start of menopause is that just helping modulate everything as much as possible. Rhodiola for memory, for fatigue. Holy basil, kind of the same thing, just for a different type of constitution. And then again, oat straw. Oat straw is in there again. I consider it an adaptogen just because you can use it long term and in larger amounts and no contraindications. Supportive foods, whoops, for the golden years. So in nutrition, with our nutrition, we're looking for high antioxidant foods, especially leafy greens. The brighter food, the better. Brightly colored vegetables, berries, seeds and nuts. Seeds and nuts are important because they have fiber, protein, and they have all the macronutrients. Sorry, the other one's escaping me right now. I love to recommend herbal infusions of the stinging nettle, oat straw, and red clover here because they're full of nutrition, which is what obviously all of us could use. Probiotic foods to add live good bacteria and yeast for our digestive tract. So we're talking about those fermented foods that are like yogurt, kefir, fermented vegetables like sauerkraut and pickles. So not the sauerkraut and pickles that are on the shelf in the store. You want the stuff that's in the refrigerated section where those bacteria are still alive. Kimchi, miso, and kombucha are other examples of probiotic foods. And then prebiotic foods. These help feed beneficial gut and our bacteria. So we're talking about chicory root, dandelion root and greens, garlic and onion plants to get that quercetin, asparagus, banana, burdock root, flax seeds, seaweed, and avocado. So, and just a few other supports that I wanted to mention. So manual lymphatic drainage is, I think everyone should know about this and doesn't know enough about it, but that's where you're actually supporting one of the least, I think, known elimination systems in the body, which is the lymphatic system. And that's, the system of like drainage throughout your body. Like your head has 30% of your lymphatic drainage. But anyway, doing these exercises where you're manually helping with that drainage is super, super helpful. I've had a lot of great success with it and recommend it to all of my clients. I've put in a link here to Dr. Caitlin, who does Doc Talks Detox. So, and she's on Facebook and Instagram. She just has a lot of kind of free information that she puts out there. She's fantastic. And pelvic floor exercises, it's still important to be doing. Last session, Dr. Krystle talked about pelvic tilts, and pelvic tilts are still important in this time frame. Kegels, but specific Kegels. So I know Dr. Krystle, you're out on the kind of the west side of the Twin Cities, but for anyone who's kind of here or east, Hudson or east, I really recommend Fit PT. You really need to have kind of an individual evaluation of what you have going on. I was in a very bad horseback riding accident years and years ago, and when I was pregnant, it became evident that I had a huge problem that I was just kind of ignoring and didn't really think was there. But after having my children, I had massive, massive issues with prolapses. And it was just things were pulled out of alignment so much. And having my two children did not help. But they were able to look at that and say, okay, so here are your issues. This is what you need to do. And I actually wasn't able to do normal Kegels. Like I had been doing them, and I had actually made my situation worse. Without the information that I needed for my specific case. And then finally is breath work. So yoga, meditation, just like Dr. Krystle had mentioned. There are free apps. There's one called Mindful and one called Breathe. And what's nice is you can set the amount of time that you want to do. You can start out shorter, work your way longer. I've found them super helpful for myself. And my clients have really enjoyed them as well as a way to, make sure that you're working it in. They'll send you reminders each day, for however many times you want to do it, for how long you'd like to do that. So, and then finally, if you want to connect with me. So if you have any questions, you want to know more about anything that I said, the links aren't working for you, anything, please just reach out to me. My website is sacredibisbotanicals.com. I have my email here, so feel free to email me. I do offer a free 30-minute healthy hormone strategy session is what I call it, but it's my free session for anyone. So if there's an issue that you want to talk about, please feel free to reach out to me. You can like and follow me on Instagram. And then I'm also involved with an organization called Well Connected Twin Cities, which is an online directory of holistic practitioners in the area. So be sure to check me out there. And that is what I have. That was a little fast, but yeah. Does anyone have any questions?
That was great. It's so much good information. I always love I have on my list now to get Brazil nuts.
Yes. Yeah. It's such a
I think that's
simple
a great,
thing.
it's
Yeah.
a simple thing. Yeah.
Yep. Yeah.
I love
Yeah.
that tip.
Thanks. Yeah. And my kids now eat them. Like it took a while. They didn't, it's not like, and I get them unsalted because I feel it's better, you know. But yeah, they're finally like, they just eat them. They don't say anything anymore. So
Awesome.
yeah. Yeah. Anyone else? Oh, there's one new message. Oh, thank you. You're welcome, Patty. Thank you. All right. Well, enjoy your solstice, everyone. Oh,
Oh,
plantains. Oh, right. This is a different plantain, though. This is a weed, Plantago major, that's here. And it's a plant that kind of looks like the leaves look like a tongue. They're green. Let me see. Oh, I probably don't have a picture on my phone right now. You'll just have to look it up. And
Okay.
plantain or Plantago major, that's the genus species, but it's growing in everyone's yards. I guarantee you, because that's where I collect mine. Yeah, it's super great. You can chew it and put it on bug bites, bee stings, splinters. Otherwise, like I said, I make an oil of it if you're interested in any of that, but it is fantastic for anything skin. We kind of have an ongoing joke in our house that like if you just try plantain first, and then if plantain doesn't work, you move to something else. So I want to have a shirt made that says got plantain because I feel like it's kind of like the gateway to to the herbal world. It's like such a safe plant and it has so many uses. So
like
That's
Windex
cool.
in Big Fat Greek Wedding.
yeah,
They
yes.
just
And actually the oil would help with that, right? Because it would help grease up the skin so you can slide it right off, right? So yeah, we use it for
Nice.
everything here. So yeah.
awesome.
Thank you.
You're welcome. Thank you.
Thank you. All right.
All right. Happy solstice, everybody.